We often talk about how fast sectors can change, globally. But it's pretty rare to see a regulatory move that just redefines an entire industry almost overnight. Today, we are looking at a massive, massive overhaul in the Turkish healthcare sector.
Hmm.
Specifically, we're talking about aesthetic services and that huge health tourism market. The whole thing really boils down to one idea. When commerce meets personal care, the rules have to change. Patient information has to come before, well, commercial persuasion.
It's a huge philosophical shift.
It is. So on November 12, 2025, the Turkish Ministry of Health published the swooping new mandate. It's called the Regulation on Promotion and Information Activities in Health Services. And look, this isn't just some minor update, it's a declaration. The message coming out of Ankara seems crystal clear. Healthcare is not a simple commodity anymore. So our mission today is pretty straightforward. We want to help you understand the new red lines that have totally replaced the old gray area in marketing. We need to analyze why the new enforcement is so financially terrifying for providers. And, finally, connect this whole transformation to what's happening globally.
And what's so fascinating here from looking at the source material is just the sheer speed and the structural depth of this reform. This isn't just new guidelines.
Yeah.
This is a wholesale adoption of really strict ethical standards.
Yeah.
They're designed not just to punish the bad actors,
Right.
but to prevent commercial exploitation from even starting.
Right.
The real core of it, the thing we'll focus on today, is the enforcement mechanism.
Yeah.
Because without teeth, regulations are just suggestions, right?
This paper.
Exactly. But before we get to the financial side, we have to lay out the new rules. The ministry has completely rewritten the playbook, and some of the immediate bans are pretty stunning.
Okay, so let's jump right in. The things that are now just flat out forbidden. If you're in the health tourism market, these are the rules you have to get your head around first.
For sure.
Let's start with what was, you could argue it was the aesthetic sector's #1 marketing tool, not just in Turkey, but globally. The before and after photo.
It's the biggest one. And it's gone.
So sharing any visual content that shows a patient's pre-op and post-op state, it's just not allowed anymore.
Strictly forbidden. It's the single biggest blow to clinics. But the why is what's really crucial here. The regulation sees those images as creating demand.
Ah, not just informing.
Precisely. They believe it implies a guarantee of a specific outcome, rather than just neutrally informing a patient about what a procedure involves. It's seen as manipulative.
And this is where it gets really strict, right? This ban holds up even if the patient gives their full consent.
Yes, even with explicit written patient consent. That's the part that's so uncompromising. The argument is that the patient is often in a vulnerable state, with a high desire for change. So they can't fully consent to their image being used as a commercial tool that then goes on to influence other vulnerable people. It just removes that entire mechanism of visual persuasion.
So that immediately shifts the whole communication model from, look what we did for this person, to here's what we are qualified to do.
Exactly. It forces them to focus on technical qualifications, a doctor's biography, objective standards of the facility, not on emotionally persuasive pictures.
Okay, moving on from pictures. What about people, social media collaborations, the influencer partnership?
Gone. The days of the influencer trip to a clinic are over. Any collaboration with a social media personality is now officially classified as covert advertising.
Covert advertising. That's a strong phrase.
It's key. It means the clinic is legally liable for that endorsement. It doesn't matter if they paid the influencer directly or just offered a free service.
So even a quid pro quo is out.
Completely. The regulation sees it as deliberately blurring the line between a personal opinion and a paid promotion, all with the aim to mislead.
And the language itself is getting scrubbed clean, too. The ministry is taking a fine-toothed comb to the terminology.
Yeah. You cannot use any of the classic sales words. Campaign, discount, free exam, all out.
And guarantees.
Illegal. No promising a guaranteed result. And this is a big one. It extends to all those superlative claims.
Like what?
You can't use subjective promotional language like best, first, top-rated, or even state-of-the-art to describe your services.
Wow. So that kind of self-congratulatory advertising is now seen as misleading and non-factual.
Correct. We also see really clear rules on showing the procedure itself.
Right. The operating room content.
Exactly. Videos of surgeries, injections, anything that's overly graphic or bloody is now restricted. The official reason is concerns over general morality and patient privacy.
Even though a lot of clinics use that to show off their technical skill.
They did, but it's now viewed as just sensationalizing medical care. And finally, on the digital side, there's a heavy restriction on sponsored posts or boosting.
So you can't just pay to play anymore.
Not in the same way. The regulation demands a shift to organic information, severely limiting the ability to just buy your way to the top of a social media feed.
That's an incredibly extensive list. It's striking. But, as we've discussed before, sometimes these rules exist on paper, but they're not really enforced. So that brings us to the core of it. Why is this regulation different? Why does it actually have teeth?
That is the most critical question. Look, if you were a marketing director in the old system, a violation might get you a fixed, flat-rate fine from the ministry.
Like a parking ticket.
It's a perfect analogy. It was an annoyance, a predictable fee. Clinics often just built it into their annual marketing budget.
So if an ad campaign brought in, say, $1 million in revenue and the fine was $20,000, they'd just pay it and keep the ad running. It was a cost of doing business.
Precisely. A cost, not a deterrent. But this new regulation has introduced a mechanism that just completely flips that risk-reward calculation. They've implemented turnover-based fines.
Okay, let's break that down.
The penalty is no longer a fixed amount. It is now calculated as a substantial percentage of the clinic's previous month's gross revenue.
Gross revenue, not profit.
Gross. That is a massive difference. We're talking about a penalty that hits the absolute core of the business's cash flow. A fine based on gross revenue could easily wipe out an entire month's net profit, if not more.
So, as the source material points out, the era of I'll just pay the fine and keep going is completely over.
It's dead. A turnover-based fine is an operational financial crisis. It forces the clinic's leadership to prioritize compliance over everything else.
And it doesn't stop with the financial hit, does it? There's an escalation now.
No, fines aren't the only tool. Repeated violations now carry the risk of business suspension.
Meaning they can shut you down.
Temporarily, yes. The ministry can close the entire facility or just shut down a specific department, like the aesthetic unit. So you put that together, losing a huge chunk of revenue, plus being forced to close.
Right.
The incentive to comply becomes absolutely essential.
To really get the gravity of this, we need to look at other sectors that Turkey already regulates this strictly. This is what you're calling the banking-ization of healthcare.
It's the best parallel. You have to look at the banking and finance sector, which has always operated under the country's tightest rules, the framework established by the BDDK.
And for our listeners who might not know, the BDDK is?
It's the Banking Regulation and Supervision Agency. Turkey's incredibly powerful financial watchdog. They govern everything from loans to investment advice. And the reason they're so strict is simple.
The stakes are high?
The stakes are high, the products are complex, and the average person suffers from information asymmetry. They don't fully understand the risk they're taking.
Which is a perfect description of the patient-clinic relationship, especially for elective procedures.
Exactly. The medical product is complex, the stakes are your physical health, and patients are highly susceptible to misleading marketing.
So when you compare the two sectors, the new rules, they just click into place.
They're undeniable effect guarantees. A bank cannot promise guaranteed 100% returns on an investment because there's inherent risk.
Right.
Well, now a clinic can't promise a guaranteed result on a medical procedure. It forces them to talk about the inherent risks of medicine, of surgery. It stops them from overselling the outcome.
And we see that same logic with advice on social media. Financial influencers have to use those big disclaimers, right? This is not investment advice.
It's a critical legal boundary. And now healthcare organizations have to adopt that same level of clarity. Doctors sharing info on Instagram or TikTok have to frame it as general public education.
And not as a personal diagnosis.
Exactly. It cannot be interpreted as specific, actionable medical advice for an individual. The liability for blurring that line just went through the roof.
This also forces a new focus on risk disclosure, just like in finance, where they have to highlight the worst-case scenarios, not just the potential profits.
Health marketing has to get that serious now. The message can't just be selling the perfect dream look. It has to objectively inform patients about potential complications, recovery times, all the inherent risks. It's a huge shift from selling a desire to providing balanced information.
Okay, so if the risk is now tied to your gross revenue from last month, the biggest change might not even be external in the ads. It might be internal. Who manages this new intense risk?
You've hit on it. It creates a need for a total internal reorganization. Again, just like a bank.
Banks have huge compliance teams.
Huge. Internal audit, legal compliance, all dedicated to regulatory adherence. Previously, a health clinic might have just called an external lawyer for reactive advice after they got in trouble.
But now,
Now, this new regulation demands that they integrate dedicated legal and compliance officers directly into their marketing teams.
well, they're proactive risk managers.
Yes, scanning every ad, every social media post, every image before it goes live to ensure zero non-compliance. It's a fundamental change in how they allocate resources. Money is shifting from glossy ads to high-priced compliance experts.
That's the proof right there. It's a structural change, not just a new rule book. So looking at the global picture, the analysis points out that by doing all this, the turnover-based fines, the strict bans, Turkey is very deliberately trying to shake off that Wild West reputation.
Absolutely. They are firmly aligning themselves with highly developed, ethical healthcare markets. They're basically adopting best-in-class models from around the world.
And we see direct parallels in Europe.
Oh, definitely. Take Germany. They're famous for their strict control over medical advertising. They have the Heilmittelgesetz, the therapeutic advertising law, and it strictly bans before and after photos for aesthetic procedures. Turkey has basically just copied and pasted that German model.
What about somewhere like France?
France treats medicine primarily as a public service. So commercial advertising is incredibly restricted. It's just objective information. Facility address, specialist expertise, contact details, no flash, no aggressive sales tactics.
And even in places where the visual rules might seem a bit looser, like the US or the UK, the regulators still come down hard on disclosure, don't they?
They do. Authorities like the FTC in the US or the ASA in the UK aggressively punish undisclosed influencer ads. But Turkey has gone a step further. They haven't just decided to punish it, they've codified it with a total ban on covert advertising.
So the global trend is clear: more transparency, less commercial hype in healthcare. But that brings us to a practical problem.
A huge one.
The Ministry of Health has to regulate tens of thousands of individual clinics and doctors. The BDDK, by comparison, only has to regulate about 30 major banks.
So the big question is, how on earth do you enforce these rules across thousands of providers? You can't do it manually, it's impossible.
And that's where we look ahead to the forecasts. The prediction is that this regulatory shift is going to trigger 3 major changes in the digital landscape to make enforcement scalable.
It has to.
The first prediction is digital accreditation. This follows that banking model, where platforms like Google and Meta stop unverified financial institutions from running ads.
Right, so we expect that same mechanism will start to apply to health providers.
Platforms might soon require clinics to actually upload a valid Ministry of Health operating license just to get access to the ad-buying platform.
Which is a brilliant move because it shifts access from being purely payment-based. Anyone with a credit card can run an ad to merit-based. Only verified, compliant organizations can even participate.
And it basically outsources a huge part of the enforcement to the tech giants,
Who already have the infrastructure to do it. The second prediction is the rise of health aggregators.
Okay, what do you mean by that?
Well, in finance, when direct marketing was restricted, comparison platforms became essential. It's the same logic. If clinics can no longer compete on price, discounts, or flashy before and afters, the competition has to shift to objective facts and reputation.
So we're talking about independent health guide platforms, aggregators that list and rate clinics based on what? Objective data.
Exactly. Physician specialties, years in operation, third-party verified patient reviews. These platforms become the trusted middleman, and they're necessary because the clinics themselves can no longer make those kinds of claims directly.
And finally, the ultimate scalable solution: AI-powered audits.
It's the only way. You can't have thousands of people checking social media feeds. The ministry will almost certainly use machine learning.
So these AI tools will be deployed to just constantly scan websites, social media, digital ads across the entire country.
Yep. They'll be trained to detect those prohibited keywords, guaranteed, discount best, and they'll use automated image recognition to flag patterns, like a side-by-side before-after split.
It moves enforcement from being reactive, waiting for a complaint, to being predictive and scalable.
So if we connect all this to the bigger picture for the industry, the era of aggressive, emotionally manipulative marketing in Turkish healthcare is officially over.
It's done.
The new currency isn't slick ad copy anymore. The new currency is trust, objective reputation, and verifiable patient experience.
The size of your marketing budget will no longer decide the winner in this new environment. The focus has just fundamentally shifted. It forces providers to actually get better.
It rewards internal excellence and transparency.
So for you, the informed learner, what does this all mean? You're basically watching a major global health tourism market mature in real time at high speed. The signal to noise ratio is about to get a whole lot better.
It is.
So ponder this. If flashy commercial marketing is outlawed and compliance risk is now tied directly to your financial survival, how might this new necessary focus on process quality and genuine objective expertise completely redefine what a successful healthcare provider even looks like? That dedication to demonstrable quality, not advertising volume, is now the ultimate standard of competition.